So I get a lot of questions from patients about what the pelvic floor is, what it does, and why physical therapy works. So here is the pelvis. At the front of the pelvis, we have the pubic symphysis. At the back, we have the tailbone. And then if we look on the under surface, we have butt bone and butt bone. So this is where you sit, this is where you sit. The pelvic floor muscle is a group of muscles that make up a hammock that slings from the pubic bone to the tailbone and goes from butt bone to butt bone. You can see here on the model that we have superficial layers to the pelvic floor, and then if we look into the pelvis, we have deep layers to the pelvic floor, which is this kind of bowl-shaped muscle here. So that is where the pelvic floor is. So what does it do? So the pelvic floor muscle has kind of 5 major functions. First 2 are bowel and bladder functions. So when we contract those muscles, it's going to close off the urethra, close off the anal sphincter, and it's going to stop the flow of urine, stop the flow of stool. When we relax those muscles, it allows for passage. The third major function is support. So if you look here, this is where our bladder, our rectum, our uterus for females would sit. So it's going to support those organs. The 5th major function of the pelvic floor is it doesn't work in isolation. It works a lot with our hip muscles. So here we can see a couple of our hip muscles and then our core muscles, including our diaphragm, to support our pelvis, to support our spine, and kind of control pressures within our abdomen. So those are the 5 major functions. So why does pelvic floor physical therapy work? So the pelvic floor is a skeletal muscle, just like any of the other muscles in our body, very similar qualities to our bicep, our tricep, our quad, our calf. We have voluntary control of that muscle, which means that when this muscle gets dysfunctional, you can come to a pelvic floor therapist who's trained in evaluating it, seeing what it is and isn't doing, and then taking you through a program to make sure that we can make that muscle function better so that you're not having issues in what I say, the bedroom, the bathroom, or even with pain through your spine and your pelvis and your hips.